Today, I'm going to be talking a little bit about one of the most prevalent of all mental health problems, generalized anxiety disorder. But first, let's review what the term anxiety means. Occasional anxiety is completely normal. We may experience it before or during stressful events, such as before taking tests, starting a new job, or speaking in public. Anxiety only becomes a problem when it starts to interfere with our daily life. There are different types of anxiety disorders. There's panic disorder, which is characterized by recurrent, unexpected panic attacks, social anxiety disorder, a condition in which social interactions cause irrational anxiety, and generalized anxiety disorder, which is what we will be focusing on today. So, what is generalized anxiety disorder? People with generalized anxiety disorder, or GAD for short, display excessive, persistent, and unreasonable anxiety about a number of things, such as money, health, family, or relationships. People with GAD might even understand that their anxieties are excessive and unreasonable, but they feel that it is totally out of their control and they don't know how to stop it. These people often struggle doing everyday things, like going to work or school, because they constantly fear the worst possible situations. Even the thought of doing these things produces anxiety. With GAD, anxiety can occur randomly with no apparent reason for concern, but usually a stressor is what triggers an episode. According to the Anxiety and Depression Association of America, this disorder affects 6.8 million adults in any given year. That's about 3.1% of the U.S. population. Although GAD can occur across most ages, the risk of onset is highest between childhood and middle age. Women are twice as likely to be affected than men, possibly because of differences in brain chemistry. The brain system involved in the fight or flight response, known as the sympathetic nervous system, is activated more readily in women and stays activated longer than men, partly as a result of the action of estrogen and progesterone. Also, some evidence suggests that the female brain does not process serotonin as quickly as the male brain. Recent research has found that women are more sensitive to low levels of corticotropin releasing factor, a hormone that organizes stress responses in mammals. According to the Diagnostic and Statistical Manual of Mental Disorders, 5 standards need to be met in order for one to officially be diagnosed with generalized anxiety disorder. These are: excessive anxiety must be present more days than not for 6 months. One must have difficulty controlling the anxiety. One must display 3 or more symptoms for adults and 1 or more symptoms for children. The anxiety must interfere with daily life activities, and disturbances must not be attributable to medication, substance abuse, or other medical conditions, such as hypothyroidism. The main symptom of GAD is frequent worry or tension. However, this psychological symptom alone can lead to numerous physical symptoms, such as restlessness, being easily fatigued, difficulty concentrating or mind going blank, irritability, trembling or feeling twitchy, muscle tension, and sleep disturbances, such as difficulty falling or staying asleep. With these symptoms, episodes of more intense anxiety may reach a level of panic attacks, which typically lasts about 20 to 30 minutes. What causes generalized anxiety disorder? Although the exact cause is unknown, several studies have found that both genetics and the environment play a role. GAD tends to run in families, so if you have a close relative who suffers from the disorder, the chances of you developing an anxiety disorder are greater. We also know that the environment is a factor because people with GAD tend to have a history of significant life changes, traumatic or negative experiences during childhood, or a recent traumatic or negative event. People who are overly sensitive and emotional, who are unable to tolerate frustration, or who have perfectionistic tendencies are often at risk as well. The amygdala, which is part of the limbic system and serves as the integrative center for emotions, emotional behavior, and motivation, appears key in modulating fear and anxiety. Patients with anxiety disorders often show a heightened amygdala response to anxiety cues, so they tend to overestimate threat or the potential for danger. There is an inability of higher cortical executive regions to attenuate the hyperactivity in the limbic system, thus resulting in some of those symptoms previously mentioned. So, knowing these things about generalized anxiety disorder, how do we go about treating it? Cognitive behavioral therapy is a form of psychotherapy that treats problems and boosts happiness by modifying dysfunctional emotions, behaviors, and thoughts associated with generalized anxiety disorder. This form of treatment involves things such as cognitive restructuring, which is the development of more effective ways to think about challenging situations, mindfulness, which is the art of learning to bring one's attention to the present moment instead of worrying about the future, and systematic exposure, which is an intervention to help people face their fears and test their extreme predictions. Other aspects of CBT involve relaxation techniques and problem-solving training. Medication is usually the second line of defense for GAD if the psychotherapy approach does not work. The most common anti-anxiety drugs are benzodiazepines, such as Xanax or Valium. Benzodiazepines work to increase the activity of GABA, the primary inhibitory neurotransmitter, and thus reduce anxiety. They exert these anti-anxiety effects in the amygdala, hypothalamus, midbrain, and several other areas. Selective serotonin reuptake inhibitors, such as Zoloft or Prozac, are also prescribed to people suffering from anxiety disorders. SSRIs work to increase the amount of the neurotransmitter serotonin in the brain by preventing it from moving back into the presynaptic neuron, thus prolonging its effects. Serotonin plays a major role in mood regulation, but also affects appetite, digestion, sleep, memory, and sexual desires. It should be noted that medications are always a bit risky. In some cases, the side effects are worth the risk. In others, it is strongly worth trying alternative treatments that do not use medications, since of course medications affect the brain. This is why psychotherapy tends to have much greater long-term advantages over medication. Other coping mechanisms, such as meditation, yoga, or exercise, may also become part of a treatment plan. Since anxiety is often accompanied by shallow breathing, deep breathing exercises can also be helpful. Generalized anxiety disorder often occurs along with other mental health problems, which can make diagnosis and treatment more challenging. Some mental health disorders that commonly occur with generalized anxiety disorder include phobias, panic disorder, post-traumatic stress disorder, or PTSD, obsessive compulsive disorder, or OCD, depression, suicidal thoughts or suicide, and substance abuse. It is extremely common for someone with an anxiety disorder to also suffer from depression. In fact, nearly 1/2 of those diagnosed with depression are also diagnosed with an anxiety disorder. There is no way to predict for certain what will cause someone to develop generalized anxiety disorder, but there are steps you can take to reduce the impact of symptoms if you experience anxiety. First, get help early. Anxiety, like many other mental health conditions, can be harder to treat if you wait. Second, keep a journal. Keeping track of your personal life can help you and your mental health professional identify what's causing you stress and what seems to help you feel better. Third, prioritize issues in your life. You can reduce anxiety by carefully managing your time and energy. And finally, avoid unhealthy substance abuse. Alcohol and drug use, and even nicotine or caffeine use, can cause or worsen anxiety. If you're addicted to any of these substances, quitting can make you anxious. If you can't quit on your own, see your doctor or find a treatment program or support group to help you.